Welcome to the Connecting Kids to Coverage National Campaign webinar. Our topic today is incorporating Connecting Kids to Coverage National Campaign resources into outreach. I'm Gabby Duran, and I work closely with the Connecting Kids to Coverage team to support the enrollment of more children and parents in free or low-cost healthcare coverage. The Connecting Kids to Coverage National Campaign's resources have been aiding Medicaid and Children's Health Insurance Program, or CHIP, outreach and enrollment efforts for groups at national and local levels since 2009. Covering a wide variety of topic areas from back to school, oral health, year-round enrollment, and teen outreach, and more, the library of free materials can be used in creative ways to inform and engage families. Our webinar today will share the wide variety of Connecting Kids to Coverage campaign materials, communications channels, and recent messaging research of target audiences. We will hear from grantees about how they are incorporating campaign materials into their outreach. In just a moment, I will walk us through the agenda. Today, our speakers will cover the variety of materials and resources the campaign offers. Our speakers will also discuss how to engage eligible families, as well as partners and other interested parties with the Connecting Kids to Coverage content and messages. We will first hear from Jessica Boscheman from the Centers for Medicare and Medicaid Services, who will cover the campaign's outreach tool library and how the materials can be used for outreach and enrollment. Next, Alyssa Allen will share the research process involved in creating and testing the campaign messages and materials. We will then hear from Johnny Vo, who will discuss how to extend the reach of the campaign messages through the social media channels of the campaign and other ways to engage eligible families online. Then we will have Holly Gillick from Kansas State University and Bradford Wild share their organization's experience using the campaign materials in their outreach and enrollment efforts. We will also address questions at the end of the webinar, so please use your chat box throughout the webinar to submit your questions to our speakers. I will now pass it on to Jessica Boscheman to kick off the webinar with a poll question. And actually, I'll be taking that poll question. So, has your organization used materials and resources from InsureKidsNow.gov? If you can select one of the responses, and we'll share them with the group. Great, thank you all for your answers. Right now, it looks like about 52% of you have said that you have used materials and resources from InsureKidsNow.gov, and 22% have not, as well as a quarter of you who are not familiar with the website. So we are excited to hear about the experiences of those who have used the materials and also share more about the ways to leverage these materials in your outreach efforts with eligible families in your community. And our first speaker today is Jessica Boscheman. As I mentioned, Jessica works in the Division for Campaign Management at the Centers of Medicare and Medicaid Services. Jessica?
Hi, good afternoon, everyone, and thank you, Gabby. And thank you for being part of today's webinar. As Gabby mentioned, my name is Jessica Boscheman, and I work in the Division of Campaign Management within CMS's Office of Communications. I've been working with our colleagues in the Center for Medicaid and CHIP Services over the last 4 years on the Connecting Kids to Coverage National Campaign. And in that time, we've created a host of tools and resources to help support organizations like yours conduct Medicaid and CHIP outreach and enrollment efforts on the local level. We love hearing from groups about how they are using our campaign resources, as well as hearing about ideas for resources we should consider developing in the future. As you probably know, InsureKidsNow.gov is the campaign's website where we house our resources. And over the last year, we've made organizational changes to the site and created a quick tutorial to help you locate tools and resources you may be looking for. I've included the link to the tutorial on the slide, but you can also find it under helpful links in the footer on InsureKidsNow.gov. Next slide, please. On the top of the website, you'll find key navigation areas. In Learn About Medicaid and CHIP, we have frequently asked questions, Medicaid and CHIP participation rates, as well as relevant campaign research. Find Programs in your state includes links and phone numbers for Medicaid and CHIP programs and dental providers in your state. I'll go into additional detail about the outreach tool library, webinars and videos, campaign notes, eNewsletter, and campaign and initiatives in the slides to come. Here's a screenshot of our current homepage on InsureKidsNow.gov. There are two main locations to find resources on InsureKidsNow.gov. Our outreach tool library showcases all of our materials by resource type, including posters, palm cards, social media resources, and ready-made articles. Another way to access these materials is to search in the Campaigns and Initiatives section on the website. This drop-down menu lets you search the materials by topic area. I encourage you to check out the Outreach Tool Library. Here you will find links to all of the current campaign materials. We've separated them out into key areas: online materials, print materials, toolkits, tip sheets, fact sheets, and public service announcements. The public service announcements currently featured on our site are live read radio scripts, but stay tuned in the months to come as we will be releasing new television and radio public service announcements in English and Spanish. The Connecting Kids to Coverage campaign materials cover an array of topics, including oral health, vision, teens, and sports. All of these materials are available for download on InsureKidsNow.gov. Our online materials include social media graphics, web buttons and banners, sample social media posts, and a guide for how you can use our tools in digital outreach. And the campaign has a number of downloadable resources to help enhance your outreach and enrollment work. These include posters, palm cards, flyers, direct mail inserts, tear pads, and ready-made article templates. And we have materials available in a variety of languages as well, including Spanish, Chinese, Korean, Vietnamese, Portuguese, and Haitian Creole. This slide just showcases a couple of sample print materials that we have available. These are the palm card sizes, but we have them available in, as I mentioned, a variety of different languages. So be sure to check out all of the offerings on InsureKidsNow.gov. You can also customize many of our English and Spanish materials to support your outreach efforts. A customization guide is available in the Outreach Tool Library, which outlines the steps that you need to take to place a customization request. The process to customize materials takes approximately 2 weeks. And we also have 2 toolkits which contain tips on conducting Medicaid and CHIP outreach in school settings, both on and off the field. InsureKidsNow.gov also features Making Outreach Work tip sheets, where we've provided a host of engagement ideas in a variety of settings and covering a number of topic areas. We will be adding additional tip sheets in the months to come, and this is another area where we'd love to hear from your organization if there is a topic we haven't yet covered but would interest you and your organization. And we have some additional tools available: fact sheets on sports outreach and dental care for children with special needs, and our public service announcements. When the new public service announcements are available, you'll find links in the Outreach Tool Library, and there's also a sample letter if you would like to share the PSAs with contacts in your community. And we've got a tip sheet containing ideas on how to incorporate the PSAs into your outreach efforts. If you haven't checked out the Outreach Video Library, please take some time to explore it. We have videos that run about 3 to 5 minutes in length. These videos feature groups like yours who are doing amazing work on the ground. The videos showcase outreach promising practices from groups across the country and in areas like oral health, back to school, engaging local businesses, and working with tribes. We will be adding a new outreach video in the weeks to come, created in partnership with the National League of Cities, which highlights working with municipalities. And our webinar and eNewsletter archives are great reference points to help generate outreach and enrollment ideas. The archive goes all the way back to 2013. So thank you very much for the opportunity to talk about campaign resources on InsureKidsNow.gov. And I will turn it back to Gabby.
Before we get to our next speaker, we're going to answer another poll question. So with the back-to-school season around the corner, we'd like to know what type of resources are you planning to use for your back-to-school outreach and enrollment efforts? Great. And thank you again for your responses. So it looks like a lot of you are planning to use the palm cards and posters along with the toolkits and the tip sheets, and a lot of you are interested in the digital resources as well. So hopefully with some of the new videos coming out, it will really give you a chance to use those as well, and the webinars for tips and best practices. Thanks so much. And our next speaker today is Alyssa Allen, who will discuss the research process that goes into creating campaign messaging and materials. Alyssa?
Hi, everyone, and thank you for having me on this webinar. So as Gabby mentioned, I'm going to be presenting on the research process that went into creating the campaign messages and materials. My name is Alyssa Allen. I work for the Division of Research, which is in the Strategic Marketing Group in the Office of Communications at CMS. Next slide. So in terms of objectives of this research, we were trying to gain a better understanding of the characteristics that define the target audience. And the target audience for these campaigns are parents of Medicaid or CHIP eligible children who are actually unenrolled even though they're eligible. And we wanted to understand perceived barriers and benefits to enrollment, the level of consumer awareness, and their understanding of Medicaid and the CHIP program, including eligibility and enrollment processes, as well as perceived relevance, the appeal and importance of Medicaid and the CHIP program. And a second objective was to determine the most effective messaging for the target audience in order to motivate them to go to InsureKidsNow.gov to see if their children are eligible for Medicaid or CHIP. Next slide. So to achieve those objectives, we did 3 different studies. 2 of the studies were qualitative studies that we did, so formative research. The first one was with parents, and we did 18 8-person focus groups. Half were in Spanish and half were in English, and we split those over 3 different markets in Miami, Houston, and Los Angeles. Participants were low-income parents of uninsured children who were likely eligible for Medicaid or CHIP due to their income. We did a second study that was also formative research with grantee staff. So there were 19 interviews that we did for that study, 15 in English and 4 in Spanish. And that was, again, with CKC grantee staff who worked directly with assisting families with Medicaid and CHIP application and enrollment. And those interviews, the people who participated in them lived in California, Maryland, Missouri, Pennsylvania, Texas, and Virginia. And the last study that we did, building off of those 2 earlier studies, was message testing with parents. And we were looking at 6 different message frames in that testing. Those were saving on healthcare costs or peace of mind, covered benefits, the help available, eligibility, ease of application, and that the rules have changed. And to do that, we did an online MaxDiff survey. And MaxDiff is a methodology that's used. We surveyed parents and we displayed 12 messages, 3 at a time, that fit into those message frames. And then they were asked to select the messages that they found to be the most and least effective in motivating them to go to healthcare.gov to find out about their eligibility for Medicaid and CHIP. And I just wanted to mention that we used healthcare.gov in this survey as a placeholder, but the PSAs developed later on use InsureKidsNow.gov. So just so you know that. And that survey was done with 300 low-income parents of uninsured children. And next slide. So these first couple of slides are the findings that cut across both formative research studies, so things that we heard from both grantee staff and parents. So one of the main things that we heard was about eligibility confusion, and that participants assumed that parents, particularly that CHIP programs, would have the same eligibility requirements as Medicaid. And so if they had applied for Medicaid before and were turned down, they thought they also wouldn't qualify, their children wouldn't qualify for CHIP. We also found out that word of mouth and peer referrals are very important for people learning about Medicaid and CHIP through friends and family, and also specific motivating events like a child's illness or injury or a medical diagnosis. Next slide. The other things that we heard were about barriers to application and enrollment. So that included things related to the application process, that parents found or expected to find the application process to be confusing or unpredictable. Also about eligibility. So parents and enrollment staff both described difficulty in understanding and meeting the eligibility requirements of Medicaid and CHIP, including difficulty reporting and verifying income due to things like their income changing or their hours that they worked that month changing and that kind of thing. There were also a number of immigration issues noted. Some non-U.S. born parents, primarily Hispanics in this research, assumed that their immigration status or lack of citizenship excluded their U.S. born children from eligibility for Medicaid or CHIP, and also that applying for Medicaid or CHIP might impact their immigration status and cause certain legal repercussions. Next slide. And the last area that came up in the interviews and focus groups with parents and grantee staff were around enrollment motivators. So that included understanding the eligibility requirements, which was an important motivator for parents to enroll their kids in Medicaid or CHIP. So they really needed to know that they met the eligibility requirements. In the quantitative study, which we'll get to in a minute a little bit more in detail, messages around eligibility ranked the highest in motivating parents to go to healthcare.gov to explore healthcare coverage for their children. And peace of mind, or the ability to pay for health costs, was also a motivating factor. Next slide. So as I mentioned, we did a message testing or MaxDiff survey with parents that kind of built on what we found in those early formative research studies. And we found that messages that focused on rule changes and eligibility were the most likely to motivate parents to go to healthcare.gov to explore coverage eligibility for their children, and they continue to be the most motivating messages. So the top 3 messages were: working families in your state can qualify for free or low-cost health coverage for their children from your state. Children, the second one, so that was within the eligibility message frame. The second one, which was also within the eligibility message frame, was that children of family of 4 earning up to $48,600 a year or more may qualify for free or low-cost health coverage from your state. And the third most motivating message, which fell under the rules have changed message frame, was that your children may qualify for free or low-cost coverage from your state, even if you don't. So as you can see, we really built on those findings from the early interviews and focus groups to develop those messages. Next slide. So just to wrap things up, this research, these 3 different studies really highlight the importance of focusing on messaging related to eligibility and that the rules have changed. Confusion around eligibility and rules were the top barriers identified by both parents and grantee staff, and messaging around eligibility and rules were rated as the most motivating messages by parents. And that's it.
Hey, thank you, Alyssa, for sharing the important research that informs our campaign materials and work. So for those of you who have been using the campaign resources, we'd like to learn a bit more about your use of them. So has your organization customized any Connecting Kids to Coverage materials? All right, looks like the majority of people have voted. So we'll go ahead, and it looks like we're about split. So about 35% of you have said yes, 40% have said no, and we're happy to hear that some of you are thinking of doing this in the coming months. So definitely please look at the materials that you're interested in and reach out to us about customization. Our next speaker is Johnny Lowe, and Johnny works in the CMS's Division of Digital Marketing, and he will share tips about how to extend audience reach using social media. Johnny?
Hi, thanks, Gabby, and hi, everybody. So my goal here today is to talk to you about how we can expand outreach using digital resources. So if you can go to the next slide, Gabby. At IKN.gov is our official handle for InsureKidsNow. Right now, we are strictly on a Twitter platform, as we see that being most relevant with you guys and everybody else and being able to present things in real time. Just a quick background of our handle right now. We haven't been around for too long, but just to kind of give you guys a heads up on numbers, per tweet that we get, that we post, we get an average of 28,000 views. So that's a good bit of number of people viewing our posts. And then with that, we amplify it with at healthcare.gov and at Medicaid.gov as appropriate based on the context of the tweet. And by doing that and doing that partnership, we can also hit the millions as far as the reach. Whether we like and retweet as appropriate, whether it's healthcare.gov and Medicaid.gov retweet our post or we retweet theirs. It's a great market partnership that we've done internally with organization from both sides, so it kind of helps us reach the millions. So knowing that with partners as well, with you guys, if you guys have certain handles that you guys have been working with, we're more than happy to work with that, and it kind of helps amplify the message along different avenues. So there could be such things as local events, sponsored materials, and just to give that appropriate respect and the ownership of the event. So that way you kind of get a little publicity from the public on the sponsored view on the side, and then as well as the national side with healthcare.gov and InsureKidsNow.gov. Next slide. So currently our editorial calendar has 3 to 5 tweets per week. There's plenty of room for more tweets, so as you see fit, please feel free to reach out to Jessica or myself if you have any different topics to discuss. I would, based on past experience we could double what we're currently doing, possibly even triple if the content is worthy enough. So please don't be scared to reach out to us if you have content that you like to be shared amongst the Twitter sphere. So within these tweets, we supplement it with additional tweets actually on Healthcare.gov and Medicaid.gov that highlights outreach materials for Medicaid and CHIP. So these are not retweets from these channels. These are actual we would call them native tweets on Healthcare.gov and Medicaid.gov that highlights materials and topics from ICANN. And again, we have plenty of followers, as well as we are following many other agencies and offices and whatnot. So we will retweet and follow and do community management. In theory, there are questions that are asked, and we can answer as appropriate with links to InsureKidsNow as a principal account, but also we have one-off websites with Healthcare.gov, Medicaid.gov, CMS.gov if necessary. So there's a lot of community management, and then being able to retweet followers has greatly amplified our message. Next topic, next slide. So I think Alyssa alluded to this earlier. Some of the topics based on the research is help with the application process. So what we can do here, just to kind of give you an idea of what we can tweet out, are links to tutorials or links to videos or PDFs that will help the readers see how they can get help with the application process. Or if there's immigration issues, like Alyssa said, Spanish and non-English speaking users are having issues with the whole process of applying and everything, we can put a tweet out in different languages just to reach out to them. We can do English, we can do Spanish, we can do Korean or Vietnamese, as Jessica said earlier. So that way we can also reach out to a certain crowd if necessary, and with the use of hashtags and everything, we can reach a certain area. So we can get very detailed as far as what kind of tweet we want to do to reach a certain audience. Eligibility, if there's a new ruling, or if there's a new press release or whatnot regarding eligibility, it's easy to put this out. We always try to put a link to our tweets to lead people to the correct site, to InsureKidsNow in theory, and then also rule changes. If there's a certain rule change and it's a very complicated rule change, possibly we have a video, a webinar again, or other tutorials that can help explain what all these rule changes are outside of a tweet, because a tweet can only have 140 characters, so it can be very hard sometimes to explain a rule change in 140 characters or less. So within these topics, I mean, there's plenty of other topics, and if you guys have topics that you guys would like for us to share, again, these are based on what we found in our research, and we kind of stick to these main topics as there's lots of different rules, different issues that we can discuss on this, but sometimes there are other detailed issues or topics that we like to discuss, and we're more than happy to put that out there on a tweet. Next slide, please. So here's the key to Twitter. There are millions of tweets go out every day. So what we want to do is be relevant. And we want to be not text heavy. So what does that mean? Is that we share links to webinars or trainings, or we can have videos embedded in our tweets. Again, there are some restrictions to them. However, showing some kind of animation or showing some kind of multimedia within our tweet definitely catches the user's eye. So if we have videos, great. If not, we can send a link, and then we can have an image or a still of the video or a tutorial or something that will catch the user's eye to lead them to where we want them to read. And again, like I said before, you want to retweet others that share your same message. This is all about collaboration and partnership. So whatever you guys want us to share, we are more than happy to do so. And whatever we have, we would hope that you guys will reciprocate the action and retweet us as well. And not only that, with the collaboration and partnership, it exponentially increases the reach while supporting your cause. One of the biggest ways to do that is to use hashtags. For our tweets internally, we use hashtag Enroll365, hashtag CHIP, and hashtag Medicaid. There are other hashtags that we use based on the initiative, but those are the three main ones. And if you guys have one that you guys would like for us to use, we are very open to discussing that option. You can also do based on location with a hashtag, and there are little keys and significant changes that we can do within Twitter that allows us to direct our tweet to a certain audience. So just to kind of note, don't be obscure about it. We don't want to do a random hashtag where nobody would follow it or there's no possibility of it becoming trending. Next slide, please. So these are some of the tweet examples that we've done over the past couple of years. As you can see, they're very bright, they're colorful. You can see the hashtags that you could believe that would be pretty popular and trending based on the time of year. For example, the first one on the top left is about spring. So we all know spring will be a popular one, and allergies and asthma. So you can see where we can get a lot of traction based on the use of our hashtags. And then just the way we write our copy allows us to kind of allude to the picture as well. So there's a little connection there. Again, you see the Enroll 365 and then both of our logos. So if you look at all three of them, they're very consistent with the look and feel of it. We can be, these are all still images. However, we have done GIFs and videos in the past as well. So just to kind of give you an example of what we can do. Next slide. Something that's been emerging as of late is Twitter chats. To briefly explain to you, Twitter chat is where it's essentially a big conversation, kind of what we're doing now, except it just lives in Twitter. We will have a host, a couple panel members, and then we'll just have a massive conversation using a certain hashtag. So my example was in February was National Children's Dental Health Month. There was a Twitter chat that was done. We did not participate, unfortunately, due to some reasons, but there was one, and we've been promoting that as well. And what it allows us to do is it allows us to become trending. It allows us to have a conversation with anybody that wants to be part of the conversation or can jump in at it any time they want. So we use the whole point of a Twitter chat is to have a hashtag that's consistent throughout every single tweet. That way you can kind of follow along and you can do a search on Twitter and see everybody speaking about it. The goal here is to become a trending during that time with thousands of tweets and just have real-time conversations with the public about what they would like us to see, what they would like to see on the site, how we can provide additional outreach, what they want to see, what we can help, and just what CMS does overall and what InsureKidsNow can do. Like I said, we can act as a host, a partner, or just a regular participant. So if there are Twitter chats that we just want to participate in and just kind of chime in whenever necessary, it's easy to do so, just understanding what the hashtag that's being used for the Twitter chat is, and just follow along and then answer as necessary. Just some key notes right there is that you really want to be careful who your partners are. Sometimes they don't align with your ideology or the way you want to present things, and then just knowing the script ahead of time, it does allow you to know what's going on and what questions should come up, and if there are any questions from the public, how to answer them ahead of time, just to kind of give you an idea. Next slide. Some more Twitter chats. Like I said, we use a common hashtag, and what it allows you to do, it expands the reach tenfold at least, based on all the users and everything. So it can become very trendy. It can overload your Twitter feed, which is a great thing from what we want to do. And from our side, from everything that we tweet from InsureKidsNow.gov, we can gain value from these analytics. We can see how many people are following the certain hashtag, how many people are following our certain tweets, what's been the sentiment behind it, how many likes have we had, retweets, how many people have actually seen our tweets, or how many people have clicked on the site if we have a link to our tweets. So it's a great way to do a big reach in a short period of time. Next slide, please. So these were some examples that we did for the National Dental Health Month for kids. As you can see, we've done the most common hashtags again for us, Medicaid and CHIP, because we want to keep hashing that out. It's all about consistency. for us. And then we would also do the proclamations hashtag as well. So for this one, it was Think Teeth. So not only do we have the Think Teeth, we have ours, and then we have, again, image and links. So there's lots of things for us to do as far as analyzing how many people see our hashtag, how many people are clicking on our link, how many people actually just see all three together as combined. So we're able to break down and see who's following what at any point based on all the hashtags that we use and all the different links that we use. We had a webinar for one of these for this particular campaign, so we're able to see how many people clicked on the webinar, how long they were on, who liked it, who retweeted, who shared the news of the webinar, and whatnot. So it was a great tool for us to kind of gain a better understanding of what the people were reading and looking at. Next slide. So again, overall, just talk about the analytics. From our post, we can do a lot of different types of reporting. We can do reach, engagement. Let's take a look at timing of when the best time to tweet is based on the certain day or the certain topic, and we can see what the best posts were based on engagements, likes, retweets, clicks. So we can kind of see what the best formula is based on the campaign. Next slide. So just kind of a brief overview, we have a design team that's internal that allows us to create all these wonderful tweets and very animated and colorful tweets. So we can do different types. Images, GIFs, videos, you name it. We have a great design team that allows us to do all these creative tweets. And they're all branded with a logo. It's very important to kind of keep that consistency and make sure that our logo and our name is out there for everything. And then we use the Enroll 365 hashtag. So again, between the hashtag and the logo, it shows a very consistent look. It lets everybody know that it's from us, and then we can also share with you guys what everything's been done. So feel free to reach out to me or Jessica if you like some tweets or if you like some ideas on what you guys can tweet about or any additional info. So thank you so much.
And thank you, Johnny, for your tips on expanding outreach messages using ICANN digital content and the platform. Our next speakers are Holly Gulick and Bradford Wild, who will share tips about how to use the Connecting Kids to Coverage materials and resources in community outreach settings. Holly and Bradford.
All right. Hello, everybody. As Gabby mentioned, I'm Holly Gulick. I'm the project manager, and Bradford is here with me to fill in any of the gaps I might miss. So next slide. Just a little bit about our project here in Kansas. We're focusing on 4 counties in southwest Kansas. You can see them circled on the map. It's Grant, Seward, Ford, and Finney counties. So they're very rurally populated with populations ranging from just about 8,000 to 37,000. And they have a very diverse population. Our grant is focused largely on the large Hispanic population as well as refugee and immigrant populations. And I'll mention this a little on the next slide, but the main organizations that are in our collaborative effort are Kansas State University, Kansas University Medical Center, Genesis Family Health, and the Kansas Health Institute. Next slide, please. All right, so we're the holders of the grant here at Kansas State University Research and Extension. We partner with Kansas Health Institute, and they help us with kind of our data collection and analysis. KUMC, or Kansas University Medical Center, and Genesis Family Health, they're assisting with a lot of our outreach and enrollment efforts. We also work with Child Care Aware, Kansas Action for Children, Communities and Schools, the Kansas Association of the Medically Underserved, as well as the Kansas Department of Health and Environment. And then, of course, through all of those connections, we're working with other community-based organizations such as health departments, coalitions, WIC clinics, youth sports organizations, faith ministries, United Way, as well as many others. Next slide, please. So here's just a couple of examples of ways that we've been using the materials with some of these partners. As you can see on the right, we have examples of materials we've had customized as well as translated. So we have one with the Communities and Schools logo that they were going to use at enrollment or
registration,
back to school events. So we have one in Spanish, and then on the right we had one translated in Somali. So Child Care Aware of Kansas, they work with families finding child care as well as other resources. They have agreed to add these resources into their toolkit sent out to families seeking child care. So just since January alone, this has been shared with 205 families. And this is also, I believe, located online for families to access as well. And then communities and schools, as I mentioned, we've had materials with their logo added, and this is used in preparation for school registration, at school health fairs, community health fairs. Okay, next slide, please. Some other ways that we use our media outreach. Kansas State Research and Extension, each county has an agent, and they are seen all the time throughout their communities. Picture here on the top right is one of the extension agents from Finney County, and she has a regular TV and radio segment with the local TV station. So she's willing to share our project materials, events, information. Just on March 8th, she did a segment, and this had reached 1,200 viewers. There's a lot of likes and shares on Facebook as well.
Yeah, and those 1,200 viewers were just on the Facebook page. It was broadcast on the air during the lunch hour, and so we weren't able to get analytics on the over-the-air broadcast, but even just having it as part of the online presence was helpful.
Right, and then also it's pictured in the bottom right corner. This is the logo that we've been using and had customized on those materials from the online resource toolkit. Since we have so many partners, it was easier to use kind of a community logo rather than try to get every single person's logo on the different resources. So for all those other community-based organizations that we are involving in the project, we try to provide them with canned messages from the online resource toolkit, whether those be PSAs, sample tweets, or Facebook posts. We try to tailor those to Kansas a little bit and give them all the resources they need to share that on their social media channels. This really helps build capacity at their local level. Community members already trust their pages. They already visit their pages and follow them. So this has been a really good strategy for us as well. And next slide, please. All right, so challenges overall, I would say mostly language and cultural barriers. We have been able to get all the translation services we need from CMS, but knowing which forms of social media are best to use is always a challenge. We've tried to involve as many community-based organizations as possible and making sure we don't miss any that are very important. But we do have many different languages and dialects that are used in these 4 counties from different refugee and immigrant populations. So sometimes making sure we have everything translated in as many languages as possible, that can be difficult, a challenge as well.
Yeah, and then one last component of those challenges as well that really goes into the language and cultural components. Since the change in perspective regarding immigrant and refugee families, I do want to give just a little bit of context to say that those 4 counties are minority majority. 3 of the 4 counties are minority majority counties, and there are a lot of agribusinesses that are there that attract refugees and immigrants from all over the world. And so one of the issues that we're also facing are that at some of the events that used to be very well attended, given some concerns about immigration status and others, some of the outreach and engagement just requires a little bit more trusted and in-depth advocacy and efforts. But the materials that we have can help us in reaching those audiences that might be a little bit more hesitant these days. And that's it.
Great. Well, thank you, Holly and Brad, for sharing your great work in your community and really giving us those insights of how you all leverage the materials and the resources from CMS to do so in your community.
You're very welcome.
Thanks again. And with that, really, we just want to thank all of our speakers this afternoon, and we wanted to remind you all that you can stay up to date with the campaign. You can follow us at IKN.gov. engage with the campaign on social media. You can retweet, share, tag messages using the hashtags that we discussed today. And please sign up for our e-newsletters that will let you know what's going on with the campaign. And if you ever want to share some of your work or have any questions, please email us at connectingkids@cms.hhs.gov. So please definitely want to hear from you all. And we have been hearing from you all through the webinar, and we have some questions that have come up that we wanted to address. We have a question that's specifically for Jessica, but can we have a little more information about how to order customized brochures? People are interested in the cost, and then do you have to have permission to use the social media graphics?
Thank you, Gabby. So as far as ordering the customized materials, if you go to InsureKidsNow.gov to the Outreach Tool Library, at the top of the page there is a hyperlink of our customization guide, and on that customization guide, on slide, slide 6, it'll show you what your customization options are, which is you can add your program name, your state's annual income eligibility limit for a family household of 4. You can include your website and or phone number and up to 2 logos. And then also in that PDF, on the next slide, slide 7, is the steps that you need to take to request the customized materials. And so what you need to do is send an email to CMS's Division of Design Services, and on that page, you'll have all the different points of information that you need to include in your email. And there's also a sample email in the customization guide as well. And it's free. We have been able to fulfill many requests over the last couple of years, and we're happy to keep on fulfilling requests from organizations like yours to help you customize these materials. And so that is, part 1 of the questions. And then the second part was if you need to get permission to use our social media graphics, and the answer is no, you don't. We've included a number of our social media graphics on InsureKidsNow.gov on the Outreach Tool Library as well. We have additional ones that we have used on our Twitter handle, and feel free to retweet those, or if you want to use them for your own purposes, we welcome it. And thank you very much for the questions.
Great. Thanks so much, Jessica. We also have one question about the research for Alyssa. Someone was just wondering when the research was done, and if you could expand a bit on the meaning of rule changes in messaging.
Yeah, so this research was all done within the last year. The messaging research was done the most recently and was conducted in January, if I'm remembering correctly, early January, late December. The rules have changed piece. It's just that, with different legislative changes over the years, the eligibility for Medicaid and CHIP has changed. And in some cases, especially with Medicaid expansion states, has gotten easier to qualify. And so raising awareness with parents that even if they applied, a couple of years ago and were not eligible, they could be eligible now.
Thanks so much for that answer. And again, we won't be able to get to everyone's questions today, but we will be following up with you all after the webinar. Along with that, the recording of the webinar will also be available on the website in 2 weeks, along with the slides as well. So if you missed any past webinars, please check out the webinar archive on InsureKidsNow.gov to see the past webinars. And remember, like we mentioned, there are campaign resources available for download on InsureKidsNow.gov. And again, thank you all for joining the webinar today. We look forward to seeing you all on future webinars. Thanks so much.